This webinar will give a brief overview of the Brain Injury Medicaid Waiver in Colorado. This information is up to date as of 1 August 2023. A waiver is an added set of Medicaid benefits that allow members with disabilities to remain in their homes and communities. The Brain Injury Waiver assists people with a brain injury who need extra support to live in their communities. The Brain Injury Waiver works in addition to services you receive through Medicaid or any federal, state, and local public program. This waiver qualifies a member for all Health First Colorado benefits except nursing facilities and long-term hospital care. Your level of care must show that you need comprehensive long-term support as well as meeting the financial criteria listed here. You must have a brain injury, be 16 years or older, and your brain injury must have occurred before your 65th birthday. Additionally, working adults with disabilities have the option to utilize the Health First Colorado buy-in program to access both regular Medicaid and the brain injury waiver services. The next few slides will go over the benefits and services listed under the brain injury waiver. Please feel free to pause and read over the services now. Consumer-Directed Attendant Support Services, or CDAS, is a way for a client to directly hire and manage the caregivers who provide their personal care. You can manage this yourself or delegate an authorized representative. You are assessed for needs and then given a monthly budget, which allows you to hire non-licensed caregivers at the pay rate you see best. Adult day services allow you to live independently and access the community. They include social and recreational services, among the other services listed here. You will need a documented medical diagnosis along with the justification for the level of care. Start at your county's single entry point. The single entry point for Denver County is Rocky Mountain Human Services. Providing a complete application and documentation will help expedite your application. Once approved for the waiver, you can begin services by working directly with your case manager. Please be aware that CDAS requires mandatory training after you are enrolled in the waiver. This concludes our webinar on brain injury waiver.